Welcome to Family Forum. I'm Beth McGee, the NAMI Finger Lakes Executive Director. Thank you for joining us for tonight's program. NAMI Finger Lakes is your local affiliate of the National Alliance on Mental Illness, the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. Locally, NAMI provides a helpline, support groups, and education and advocacy opportunities for families and friends of people living with mental health conditions. All of our services are free. This event is being recorded and will be available on the NAMI Finger Lakes YouTube channel soon, where you can also find our previous family forums and other events. After tonight's event or presentation, we'll have an opportunity for questions, which you can submit in the chat. Please hold your questions until that time so we don't lose track of them. So let's get started with tonight's program. I'd like to welcome attorneys Brandy Tomlinson and Joshua Rosenthal of Disability Rights New York. Brandy joined Disability Rights New York in September of 2014 and has served as a staff attorney in the Protection and Advocacy for Individuals with Mental Illness program at DRNY for 7 years. Brandy has experience in matters involving youth and adolescents, particularly those residing in residential facilities and programs. Brandy works to ensure the safety and rights of these children, as well as assisting parents and guardians with the knowledge and advocacy skills to advocate on behalf of these youth and adolescents. Welcome, Brandy. Josh Rosenthal is a senior staff attorney at Disability Rights New York in the Protection and Advocacy for Individuals with Mental Illness program. Josh advocates for the rights of children and adults with disabilities, including by monitoring conditions for people held behind bars and by serving as counsel on a class action lawsuit that challenges the lack of community-based mental health services for adults leaving incarceration. Prior to joining DRNY in 2018, Josh was a senior staff attorney at Children's Rights, where he litigated class action lawsuits on behalf of youth in foster care and juvenile justice systems. You both have impressive backgrounds advocating for youth needs, and we're really grateful to have you here with us to share your wisdom. And this will also serve as a really comprehensive resource for us to share with families. So thank you so much. Would you like to take a moment to introduce yourselves a little bit and talk about your roles there and why you're with us tonight?
Sure. Well, and before we get started, as Beth said, I'm Josh Rosenthal. I'm with the PAMI program, and I'll let my colleague Brandy introduce herself as well.
Hi, everyone. I'm Brandy, and I'm also in the PAMI program with Josh, and I'm happy to be here tonight.
One of our principal goals here this evening is to not only kind of talk about mental health services for youth, but also introduce you to us, to DRNY, the types of services we provide and can undertake. And so I think both Brandy and I will have our contact information available on our Zoom screens, and we'll be putting it up momentarily as well when we kind of go through our PowerPoint. Before we go too in depth, we wanted to sincerely thank Beth for inviting us this evening and NAMI Finger Lakes for hosting us. We're very excited to be speaking with you all today about an issue that we at Disability Rights New York advocate for and feel very strongly about, namely the rights of children and adolescents to access appropriate mental health care. And we really have three goals for our presentation. The first is to explain who we are, the types of advocacy and legal services that DRNY undertakes across the state to protect the rights of people with disabilities. Secondly, we'll talk a little bit about the right that Medicaid eligible children have to receive community-based mental health services. And we'll give an overview of at least some of the mental health services that should be available to youth in the state, given how New York State has chosen to structure its Medicaid system. We'll be kind of beginning to really just scratch the surface there, but we hope to, at the very least, introduce a familiarity with all of the acronyms, all of the terms, all of the language that's kind of wrapped up in understanding the service array in New York State. And finally, as Beth said, we hope to maybe at the end have at least a very brief discussion about the types of barriers that parents and caregivers may face when trying to secure the mental health care, the mental health services that their children need. And would love to hear more about kind of what the Finger Lakes region, what Tompkins County are experiencing. Because despite how important mental health care is for children, we all know that too often those services that children need just aren't available, or it takes far too long to get them, leading to devastating impacts for children, for families. And of course, this has been only heightened during the COVID-19 pandemic as families face the uncertainty, the fear, and the loss as we've gone through the past year and a half. So I'm going to start to share our slide, and please let me know if there's any trouble seeing it. You know, as we talk today, we really hope that whether you're watching this live with us this evening, or you're watching a recording later, we really hope that you'll keep in mind 4 questions during our presentation as we talk about the types of mental health services that should be available to children. And the first is, what types of community-based mental health services does your child need? Could your child benefit from counseling? Does your child need medication and medication management? The second is pretty simple. Are you able to get these services? If your child needs to see a counselor, if they need to see a psychiatrist, are you able to connect your child to those mental health services in a timely way? Are there providers in your counties, in your communities, that are able to give the mental health care to your child that they need? If there are, how long does it take? Is your child able to see those mental health staff in a timely way? Or are there wait lists? Does it take weeks? Does it take months? Is it quicker than that? And finally, if there are obstacles, what are the obstacles that you face when you're trying to access the mental health services that your child needs? And so we hope that for those with us this evening, you'll keep these questions in mind as we go through our presentation. And for those at home, we hope you'll keep these questions in mind as well as you think about what your child needs and whether they are able to get that. And I'm going to now turn this over to my colleague, Brandy.
Thank you, Josh. I'm going to give an overview of Disability Rights New York and tell everyone a little bit about what we are and who we are. So Disability Rights New York is the statewide protection advocacy system and client assistance program. We serve individuals throughout the entire state with disabilities. We were designated as the Protection Advocacy Agency in 2013. We are a not-for-profit organization that receives federal funding, and we have 3 different offices currently located in Albany, Brooklyn, and Rochester. Next slide, please. So the PNA first developed due to the Willowbrook situation. The PNA's original purpose was to protect individuals with developmental disabilities living in institutions from abuse and neglect. The PNA mandate now covers all types of people with disabilities and a broad range of issues, and includes all settings as well as the community. We have various programs at Disability Rights New York that cover all different types of disabilities. The first one is PAMI, which is for individuals with serious mental illness. The second one is PAD, which is our program for intellectual and developmental disabilities. A PAIR program is for individuals with physical and sensory disabilities. A PAPI program is for individuals with traumatic brain injuries. And we also have other programs such as assistive technology, rehabilitative services, voting rights, and Social Security. What kind of work do? We do a wide range of things. We do monitoring and investigations. Monitoring is where we will actually go in person on site to facilities in the state that serve individuals with disabilities. We will look for them. We not only want to speak with individuals with disabilities, but we want to also make sure that everyone's rights are being protected, that there's no violations going on, no abuse and neglect. And, you know, we also want to assist with investigation. In investigations, we are looking for if there abuse and neglect. For example, if we receive a complaint, it can be from an individual or it can be through the media, the news report. We want to investigate those complaints that we've received. We also provide direct legal services and advocacy. Example of legal services and advocacy would be, let's say someone has reached out to us with a request for assistance with a special education matter. For example, let's say a parent has a child with a mental illness. She's struggling in school, but the school district refused to give the child an individualized education plan or a 504 plan. We may be able to assist with those kind of things. We also do a wide range of issues. I mentioned special ed. We also do housing. We do emotional support animals, service animals. Our work is really focused on ensuring the rights of individuals with disabilities under the Americans with Disabilities Act, as well as other federal and state laws, such as Section 504, and then Fair Housing Act, which is where emotional support animals would come in. We also do systemic advocacy and litigation. Those kinds of work are focused on ensuring the rights of individuals with disabilities and enforcing them. If an entity or a facility is refusing to implement those rights, we may advocate either through systemic advocacy or will initiate litigation on behalf of individual or a class of individuals with disabilities. We also do education and outreach. For example, this would be considered an outreach activity. We also provide education to, for example, colleges. We have done many education training sessions to colleges. We also do provide information and referrals. That's if we get a call, but we're not able to provide legal representation or advocacy or any other type of work that we do. We always try to give individuals information to other agencies or attorneys that may be able to assist them with their issues. And then we also provide technical assistance, and that can be advising, for example, a medical facility regarding their obligation to comply with the Americans with Disabilities Act. So this little chart here gives us the various areas that we cover, and each individual request for assistance that comes in, we call them a service request. And so each area that we have here in this chart describe the typical areas that we get. For example, abuse and neglect, accessibility, and you will see here that the highest one that we get is regarding obtaining or maintaining benefits, such as Social Security benefit. So these are the kind of services the DRNY is not able to provide legal assistance on, and in these cases, we would provide referrals or technical assistance, such as emergency services, criminal defense. We don't do family law, or representation in housing court regarding an eviction. So although we can assist with a reasonable accommodation housing, we can't do more specific matters like eviction. And then other non-legal services, such as, we're not able to provide case management or to help someone find housing. But we do, as I mentioned before, we do provide referrals to other organizations who may be able to assist with these matters if we're not able to. I will now turn this over to Josh to get us started on the community-based portion of this presentation.
Thank you, Brandy. So we wanted to turn now to talking about some of the rights that children with mental illness have to receive mental health care in their homes and in their communities. Now, this is a topic we could spend days talking about. We're really just scratching the surface. Children, for example, have rights, as Brandy mentioned, under the Americans with Disabilities Act. Some children have constitutional rights, particularly if they're in state or government custody. But for today's purposes, we really wanted to focus on a key right that's provided in the federal Medicaid law to children. And if there's only one thing you take away from our presentation, we really hope it's this key point, namely that children on Medicaid have a right to receive a broad array of medically necessary mental health services. Now, to understand where this right comes from, it's necessary to understand first about a provision of the Medicaid law called Early and Periodic Screening, Diagnostic, and Treatment Services, EPSDT. And this is the first of, I'm afraid, many acronyms that we're going to be discussing today. But EPSDT, as I said, stands for Early, Periodic Screening, Diagnostic, and Treatment Services. And in short, it's a portion of Medicaid. It's a Medicaid benefit that provides for comprehensive and preventive healthcare services for all children under the age of 21 who are enrolled in Medicaid. So as it says here, it provides for screening services, provides for vision services, provides for dental services for kids, hearing services, and really important when we're talking about the provision of mental health care to Medicaid eligible children. The federal Medicaid law requires that states make available such other necessary healthcare, diagnostic services, treatment, and other measures described in the Medicaid statute to correct or ameliorate defects and physical and mental illnesses and conditions discoverable by the screening services, whether or not these services are covered under the state plan. Now, there's a lot in there that I just read, but in short, really what it means is that under EPSDT, federal law requires states to make available to Medicaid eligible children any type of care and services that are listed in the Medicaid statute when those services are medically necessary for those children. And what do we mean when we say medically necessary? New York State law has a particular definition. The federal government has given guidance on this as well. But in effect, medical necessity is a determination made for each child on a case-by-case basis, taking into account the particular needs of the child. And medical necessity is determined when this particular service in question would correct or ameliorate a child's condition. And the reason we're getting into some of these very in-depth pieces of language here is that medical necessity does not mean that the service has to cure the condition. Instead, only that the services in question can maintain or improve the child's current health condition. And if so, they are medically necessary for that child. Now, as I mentioned earlier, EPSDT in federal law only requires that states make available certain services that are listed in the Medicaid Act. But that list of services is extremely broad and extremely comprehensive, and it includes an array of mental health services that must be made available to children that children have a right to when those services are medically necessary. So for example, EPSDT requires states to make available certain clinical services and physician services provided by licensed professionals such as therapists and psychologists, and rehabilitative services such as crisis services, counseling, therapy, and medication management. So the scope of children's rights to receive mental health care under the EPSDT provisions of federal law is really quite broad. And I should say also that under federal law, children have the right to EPSDT services, regardless of whether they're enrolled in managed care or they're straight fee-for-service Medicaid. Now, to understand exactly what the rights of children in New York State are to receive mental health services under Medicaid, it's important to understand the litany of terms and acronyms that New York State has rolled out and the way New York State has decided to provide mental health care to youth on Medicaid. So we wanted to go through some of those services that should be available in New York State Medicaid eligible children. But before we start on that, we did want to make a quick note. Brandy and I are obviously not mental health professionals. We are not service providers. We are not a state agency or county officials. And so when it comes to finding the services that your child needs, we do urge you to look to the New York State agency websites for official guidance and information. to speak with your providers, with your doctors, with your psychologists, counselors, with your care managers, and with your county officials. But even as attorneys, we've found it's important for us to pass along this information because far too often the families that we've spoken with aren't told about the kinds of services that should be available to them. And all of the acronyms, all of the information that they need to know about just never makes it to them. And it's critical to understand the terms that New York State uses to describe mental health care for Medicaid eligible kids, because without that, you won't know whether your child, your family is receiving all the services that they may be entitled to. So starting out, we can talk first about a group of mental health services that New York State calls Children and Family Treatment and Support Services, CFTSS. Now, CFTSS is a package of mental health services that are authorized under the EPSDT provisions of the federal Medicaid law that we talked about earlier. And they're one result of the nearly decades-long process of redesigning the state's Medicaid system. And the state's stated goal with rolling out this package of mental health services called CFTSS was to enable a greater focus on prevention and early intervention for children by providing a greater array of available services and the capacity to intervene earlier on in a child's life. In other words, these services were intended to be made widely available to kids in the state, to any child on Medicaid who needed them, and to be available early in that kid's life to prevent behavioral health conditions from worsening and to prevent the need for more restrictive, more higher intensity services later on. And indeed, when you look at the types of services that should be available under the CFTSS umbrella, they're pretty broad. So one type of service is called other licensed practitioners, sometimes referred to as OLP. Now, OLP really refers to non-physician licensed behavioral health practitioners. So this could include licensed psychoanalysts, licensed clinical social workers, licensed therapists and counselors, all of whom can be providing within the scope of what they're licensed to do, services like assessments, like treatment planning, therapy, and in some cases, crisis intervention. On that note, CFTSS should also include crisis intervention for youth. These are mobile services provided to children who are experiencing what are called acute psychological emotional changes, mainly mental health crises, that their families may not be able to resolve on their own, that they may not be able to control on their own. And here too, according to the state, the goals of crisis intervention were to engage the child, to reduce their symptoms, to stabilize the child when necessary, and then to restore them to a previous level of functioning and promote those coping mechanisms for children within the family unit. In other words, to de-escalate crises and try to prevent future ones. There's also community psychiatric supports and treatment, often referred to as CPST. Now, CPST refers to a group of services focused on therapeutic interventions like counseling. So these services were intended to address challenges associated with children's behavioral health needs and to achieve certain identified goals and objectives within a treatment plan. So the CPST includes a number of different what are called components, including rehabilitative psychoeducation, intensive interventions, strengths-based treatment planning, rehabilitative supports, crisis avoidance, and intermediate-term crisis management. Relatedly, CFTSS should also provide psychosocial rehabilitation, PASAR, to children, to help children build those social and interpersonal skills, their daily living skills, and their ability to succeed in the community. Under the CFTSS umbrella, families should also be able to access what are called peer supports, family peer support services. Now, these are formal and informal supports that should be made available to parents and families and other caregivers that support self-advocacy skills, parent skill development, and help families make the decisions that are right for them while being involved with the mental health system. And they're provided by family peer advocates with similar lived experiences. And similarly, youth peer supports are also formal and informal supports provided to a child or to an adolescent by someone who's had the similar lived experience to them, to help that child develop skills and coping mechanisms, to feel empowered to make decisions, and to make connections and to get help. Now, all of these CFTSS services should be available to children in their homes and in the communities where they live. So who is eligible for CFTSS services? Well, because these are really rolled out under the EPSDT mandate, it should be pretty broad. A lot of children should be eligible to receive CFTSS. And really, in particular, there are three things that go into eligibility determinations, including first, is the child enrolled in Medicaid? Second, it must be a child or adolescent. But as we've talked about here, in the context of Medicaid, that means that the recipient must be under the age of 21. So including what some may say were young adults as well. And finally, most complicatedly, there must be a determination that the child has that medical necessity for a specific CFTSS service, just like we discussed with EPSDT. Now, excuse me. It's beyond the scope of our presentation today to go into the details of exactly how those determinations are made. New York State has published very detailed guidelines that are available describing what is required to determine medical necessity for each CFTSS service. But it's helpful to make this distinction between referrals and recommendations. Now, anyone can refer a child for CFTSS. This can include a parent, a provider, or even the child themselves, according to New York State's guidance. But unlike a referral, a recommendation is sometimes the term used for that medical necessity determination. And medical necessity can either be made, that determination that a child has a medical necessity can either be made by a CFTSS provider or by another licensed provider of the healing arts. So if it's not being made by the CFTSS provider, the child has a need for that service, could be made by another LPHA, which includes a registered professional nurse, a licensed psychologist, licensed master of social work, a physician, or various other licensed providers that could be conducting that assessment for your child. Now, how do you find CFTS providers? How do you get access to those services? And this is one of the things that we are often speaking with families about and hearing concerns about it's well and good to talk about all the types of services that should be available to families. How do we in fact get them? Now, New York State has published some guidance around or recommendations that families contact their Medicaid managed care plans. If they're enrolled in a health home, to speak with their care manager. And there's also on the Department of Health's, the State Department of Health's website, a tool to find designated CFTSS, and we'll talk about this, but HCBS providers in your counties, in your areas. And this is a little bit what that website looks like. But one thing, and we can talk about this a little later on, is that accessing CFTSS services can be tricky and can be complicated, and all too often what we've heard can result in wait lists or families unable to get those services in a timely way. And so we can't represent and for any of the information that would be available on this website. This is the state's website, but this can be one area where you might want to try to find and look up CFTSS providers. I'm going to turn this over to Brandy in a minute, but I also want to pause here very briefly and say that if you're listening to this presentation, and if you have a child who's on Medicaid, and that child has a diagnosed mental illness or a psychiatric disability, and you've never heard of some of the services that we're talking about today, or you have, but you aren't able to access them, this may be a violation of your child's EPSDT Medicaid federal rights. And so we really do encourage you to reach out to us if you have those questions or concerns. And now I'm going to turn this over to Brandy to talk a little bit about waiver services under HCBS.
Thank you, Jeff. I'm going to talk about another category of services, and that is the home and community-based services, which I'm going to refer to as HCBS. So the goal of HCBS services is to allow children and youth to remain in their home or in the community, or to assist children and youth who are being discharged from an institutional setting and safely returning to their home or their community. So there's various types of services that are available through HCBS. And if you look at the list, you'll see the services that are available are caregiver, family support and services, supported employment, respite services, environmental modification, vehicle modification, and non-medical transport. And there's all those different categories that should be available. So there's different criteria to be eligible for HCBS. So I'm going to talk about the first one first, which is target criteria. And the first thing that you need to know about target criteria is just the focus is on disability. So the criteria is that you must be a child with a physical, developmental, or mental health diagnosis who has a significant need that places them at risk of hospitalization, or who need to return safely home and community from a higher level of care. From higher level of care, we're typically talking about psychiatric hospitalizations or residential treatment facilities. So the second category is financial. There's two ways to meet this. The first one is via family income, which is the traditional way. That's where you're including the entire family's income. But let's say that going that route would make a child not eligible for Medicaid. There's a second way to get that child eligible for Medicaid, and that's via the child income, also known as family of one. What that means is that we're not going to include the entire family's income. We're only going to include the child income. And based on that, the child would become eligible for Medicaid. The third category is an assessment, and the assessment will cover different areas. And I'm going to go over a few of them. So the assessment must be completed by the home health care manager if the child is already on active Medicaid. If the child is not on active Medicaid, or the child is on active Medicaid, but they decline home health services, then what's known as Children and Youth Evaluation Services, often known as CYES, they would conduct the assessment. So the assessment will cover various areas that we have listed here: the target criteria, specific and functional criteria, risk factors, and Medicaid eligibility. And I'm going to talk about each one a little bit. So the target criteria, we just briefly mentioned, and then there's the risk factors. For example, so we have a child with, thank you, Josh. So for example, there's the risk factors and functional criteria. And when we also talk about the Medicaid eligibility, that's where we're going to get into the two levels of what they're called two levels. And the eligibility, the first eligibility, Medicaid eligibility, is level of care. That is for children that meet institutional placement criteria, such as serious mental illness or developmental disability in foster care, medically fragile, or medically fragile with developmental disability. The second Medicaid eligibility is the level of need. Children who are at risk of institutional placement. For example, serious mental illness with or without substance use disorder, or abuse, neglect, and maltreatment of health home complex trauma. Next slide, please. So how does the child receive HCBS services? So once the assessment has been completed, the determination will be sent to the Department of Health. The Department of Health will then review the determination and will notify the individual who completed the assessment, which would be either the home health care manager or it would be CYES regarding the assessment. And if there's any openings, the child will be put on a slot for new children for any opening. If there are no openings, then the children will be placed on a wait list. And I am now going to turn this over to Josh to discuss additional barriers for discussion.
Thank you, Brandy. So at the start of our meeting today, we kind of had laid out these 4 questions. Really, what types of community-based mental health services does your child need? Are they able to get them? If they are able to get them, how long does it take? And what obstacles do you face? And part of the reason we ask these questions is because we've heard about obstacles across the state. Children who aren't able to get the OLP, counties that don't have crisis intervention providers in their area, other concerns about kids getting the critical mental health care that they need in a timely way, and mental health care that has only become more and more important because of the perils and the stresses of the pandemic. And so we did want to open it up for discussion to hear, and we can share more as well, about any issues that the Finger Lakes area may be seeing, that Tompkins County may be seeing, and as well as any other questions or discussion points. And Beth, I know if you're on, if you wanted to raise any particular questions at first, or else we can kind of dive into it as well.
Sure. Thank you both. This is a lot of information to take in, and it's no wonder parents don't know it all. And I, there are so many things and so many services, not just for mental health, but for many other things that we just don't do a good job of informing people about. And I imagine it's frustrating to be in a field where you know that these services are necessary and yet you're unable to provide them. So that's got to be a difficult position to be in our community, because there are such barriers to services for children. I do want to, you've mentioned that people can reach out to you. And I want to clarify, or have you clarify for them what that looks like. So when people hear attorneys, they may not necessarily understand or know what service you provide for them if they call. And if it's just answering questions or consulting, or if there's a fee associated with that. So could you clarify a little bit about that?
Sure, I can start, and I'll let Brandy join as well. First of all, I will say that there's never a fee for disability rights in New York's legal services. We are an independent nonprofit. We never charge our clients whatsoever. And while we receive federal funding and we're designated by the state to serve as the Protection and Advocacy system, we are an independent, completely independent nonprofit. Every case that we, every time either an adult or a parent or even a child calls us about an issue that they're having or potential discrimination they're facing as a person with a disability, we assess that case on an individual basis. There's some cases that we can help support. We have, so for example, special education advocacy we undertake, advocacy on behalf of youth in residential facilities who are at risk of abuse or neglect. On other times, we can try to provide technical assistance. So for example, as Brandy mentioned, we aren't housing court attorneys, we're not family court attorneys, we don't provide criminal representation, but very often we can provide some technical assistance either to the client or even to another attorney about the disability angles to these areas of law. And when in any given case we aren't able to provide individual advocacy or technical assistance, we also try to provide any referrals that we can. We have some very good relationships with the network of amazing advocates in the state, and can hopefully try to provide referrals when we can. The other thing I would say is that, as Brandy had mentioned, a lot of what we do is we take on systemic advocacy. We can raise concerns with facilities or with the state or with other stakeholders. And so it's critical for us to really hear from you all in the communities. How is it going there? Are you able to get these services? What is the reality of the state for children's mental health care? Which really kind of informs so much of our advocacy and so much of how we hope to be able to help. Brandy, is there anything you wanted to add to that?
Yeah, Yeah, I think I, kind of want to give maybe a little bit more background on. So what happens when you call Disability Rights New York? The first person you're going to speak to is our intake specialist. And what they're going to do is they're going to listen to your story. What are you calling us about? They'll take your name if you're comfortable sharing it. There's some instances where individuals, if, for example, they want to call us to make a complaint, they may not want to share their name, so they just might want to be anonymous. But if you're a parent or an adult, you would want to share your name, your phone number. And then what happens is the intake specialist will create what we call a service request. And then this service request then goes to a program director. So for example, in the PAMI program, the service request would go to our PAMI director, and then our PAMI director would review it, and he would assign it to a staff attorney, such as Josh and myself or other colleagues. And then we strive to call everybody that contacts us within 5 business days. Sometimes, life happens. It sometimes might take us a little bit longer, but we do strive for that. And we also do not charge a fee. We are free, so it doesn't cost you anything to contact us. If we decide to represent you or provide advocacy, and advocacy could be writing a letter for you or attending a meeting for you. It's not going to cost any money. And so that's what it would really look like. And, we're really, we really do try to do our best to help everyone that comes through. And, like I mentioned earlier, if we're not able to, we always provide information and referral.
Thank you. I love details. That was very detailed. It's helpful when people, especially with parents or anyone who's going to call you, they're likely under a lot of stress and a lot of worry. And this way, it's kind of mapped out for them what that's going to look like. And while we're here to discuss rights for services for children, am I correct in thinking that you're not going to just advocate for parents of young children? Is this accurate?
That's correct. We also represent adults as well, not just children. Yeah, okay. As long as the adult has a qualifying disability, we cover many different types of disabilities. So absolutely, we are just adults as well.
Okay. And does a person have to have that disability designated or under the PAIMI services, if they have a diagnosis that they're not getting adequate treatment or care for, or there are barriers to service for them, do they have to be designated with a disability in order to receive your advocacy?
No, the PAMI program is actually the only program that requires documentation of your disability. And what it comes from is our federal funders. They require documentation in order for us to provide assistance. And that documentation, it doesn't even have to be a doctor's note. It can be a hospital record from the last time you were discharged, or even if your doctor's office has a patient portal and you can log into the portal and just do like a little print screen where it lists your diagnosis, like those kind of documentation would be sufficient. Our program do not have the documentation requirement though, just the PAMI program.
Okay. And when you say diagnosis, is a diagnosis considered the disability, the documented disability?
Yeah, so when we say diagnosis, particularly for the PAMI program, it has to be a serious mental illness. Mm-hmm. For example, anxiety, for example. It can't just be like, regular everyday anxiety that, all of us have, especially with COVID-19. It has to be like, generalized anxiety disorder, like you've been diagnosed with it, not just like everyday anxiety. Another example that comes to my mind, same thing with depression, to be considered serious mental illness, we're generally looking for that you've been diagnosed with like, major depressive disorder, those kind of things. I can't be like a general diagnosis.
Okay. And I just want to let participants know that the chat is open. So if anyone has any questions, we'll be here for a few more moments. And if you have any questions to share in the chat, we'd be happy to share them with Josh and Brandy.
I'll just quickly add, I'll say in particular, I know, because it can always be tricky to know where a child is, like, does my child have a disability or not? And I'll say in particular with children, if you're kind of thinking about some of the issues we've talked today and you have a question, does my child have the disability such that DRNY could help? You can always ask, you can reach out, and we'll do our best to get back to you right away with an answer.
Great, thank you. If anyone is interested in the fact sheets for these services that Josh and Brandy have shared, I am happy to send those to you if you just email us and request them at help@namifingerlakes.org. I am not seeing any questions in the chat, but I always take that to mean that you have provided a really thorough presentation, and that when people want to communicate their needs to you, that they will do so in private. So would you like to share any final thoughts this evening, or do you think there's anything we have not touched on that's important to share before we go?
Well, first, we really want to thank you again, Beth, and NAMI Finger Lakes for having us. We hope that not only NAMI, but all of your members and anyone listening to this, whether you're a parent, whether you're a person with a disability, whether you're a provider or a county official or others, that you think of DRNY as both a resource and an ally. And I think, one of the concerns we often hear from parents is that it's important to know enough to know that your child's rights may be violated. And so please, if you have questions, if you have concerns about anything that we've discussed today, feel free to reach out to us. And if you reach out, we've put up the general DRNY contact information on the screen here. If you reach out and give them my name or Brandy's name, they can then connect you with us as well. But again, please feel free to reach out. And again, Beth, we very much appreciate the opportunity to speak with you all tonight.
Certainly, we're really grateful to have you here with us. And again, this is great, valuable information. And I really want to thank Disability Rights New York for the great opportunities we've had over the last 2 months with our planning for our future family forum that we did in August with David Young from your organization. That was really informative, and this is just another great way to reach out to families and inform them of really important things that they need to know. So Brandy, did you have any final thoughts that you wanted to share? We all set?
No, I don't, other than, thank you for having us. And just, a quick reminder to everyone that, Disability Rights New York is here for you. If you have any questions, even if you don't if you don't have a legal issue, give us a call, even if you just want to know about your rights or you just have a lawyer concern, we're really here for you.
Thank you. That's great. So I guess we will finish this evening. And again, thanks a lot. And thanks to everyone who attended. And we appreciate Disability Rights New York staff. And you'll be able to reach out with any questions for us also at help@namifingerlakes.org and more at our website, namifingerlakes.org. So be safe, everyone. Good night.